Good morning, everyone. I'm Marla Gordon. I'm the Director of Clinical Services here at Kendal at Home. We appreciate you joining us this morning. And as we all know, open enrollment for Medicare is right around the corner, starting October 15th. And we are pleased to have with us today Kevin Loudon with Retire Med, hopefully answering some of those questions, making the confusing decisions a little less confusing for everybody. And Kevin, I'm going to turn it over to you. We're glad to have you here with us today.
Thank you, Marla. I appreciate it. Good morning, everybody. As Marla said, we're entering Medicare's open enrollment period, so we're going to talk a little bit about whether or not your plan is right for you in 2023. Certainly, we encourage people to review their Medicare plans every year, and I just want to kind of go through and maybe hit some high points and some questions that people might have. We'll have a little bit of an introduction, talk about the annual enrollment period that's going on right now. Some updates for 2023, some changes that are coming down the pike from that standpoint, and then kind of what you need to do to prepare for this particular point in the year. Talk about maybe some reasons to consider changing your plan in 2023, and then talk a little bit about Retire Med and the services that we offer and how we work with our clients. Marla, correct me if I'm wrong. I guess we're going to hold questions until the end.
Yes, sorry.
Have people type them into the Q&A box.
Yes, as we go along, if you think of a question, you can click either Q&A or chat and type those in, and we'll save those for the end here. Please just also be mindful that as you ask questions, Kevin certainly can answer general questions, but would not be able to get into the specifics of your exact needs.
Yeah, and that's true. We can't, in this kind of a setting, just due to Medicare compliance rules, talk about specific insurance companies or specific plans, but we can talk in generalities. So just in terms of an introduction to Retire Med, our whole mission in life is to simplify Medicare for folks. So whether you are a person who is currently on Medicare and kind of looking for some guidance around the plan that you're on or might have questions around that, we can certainly help you from that standpoint. We also work with a lot of people who are in the process of retiring and leaving group health insurance through their employer, or possibly leaving individual plans as they approach age 65. As I said, our whole mission is to just take the stress and anxiety out of that transition to Medicare and the questions around Medicare. We are a no-cost service, which is nice, so we can provide the information and the help to you at absolutely no cost. Been around for about 15 years, and our kind of footprint covers Ohio, Indiana, and Kentucky. So let's talk about annual enrollment. The annual election period is here now. It is here for those people who already have Medicare Part A and Part B in place. For those people who are considering starting Medicare, maybe aging into Medicare, that type of thing, this annual enrollment period really doesn't necessarily apply to them unless they happen to have a birthday sometime between October and December. The annual election period lasts from October 15th through December 7th. So you've got about a 6-7 week period there to make any changes that you want to make. And those changes will take effect on January the 1st of next year. So we get some questions every year about this time because, again, Medicare changes, it gets confusing. People want to know, do they have to enroll in Medicare each year? And the answer to that is no. Once you've enrolled in Medicare Part A and Part B, you're in. So the actual Medicare enrollment is done and taken care of. Do you have to renew your Medicare Supplement or your Medicare Advantage plan? Typically not. Your Medicare Advantage plan will automatically roll over each year if you don't take any action to change it. And as far as supplements are concerned, you can change from a supplement plan to an Advantage plan. But again, if your supplement plan is a good fit and you want to just stay in that, you can do that and it will roll over automatically. Any penalties if you fail to do something during the annual enrollment period? Definitely not. It's just here so that if there are plan changes that need to be made, if there are changes that have happened, for example, to your prescription drug plan, or changes that may have happened to your Medicare Advantage plan, or there may be a better option in Medicare Advantage plans, you can make those changes. But if everything is good and you want to stick with exactly what you've got, there are no penalties, there are no issues around that. You can just sit back and ignore the commercials on TV and you're going to be fine going forward. But just in terms of a little preparation and some things that you might want to do during this time period, Unfortunately, people think that Medicare is kind of a one and done type situation in many cases, and it really isn't. So there is some preparation that we encourage people to take. There are some steps that you can take. First of all, you want to sign up for a Medicare.gov account if you don't already have one. It will tell you exactly what your coverage is, the plans that you're on, and that type of thing, just to confirm that that you have what you think you have. You'll also want to talk to your doctor, especially if you're enrolled in a Medicare Advantage plan, because there are those situations where network providers change, drug coverage can change, and those sorts of things. So especially if you're in a Medicare Advantage plan, please talk to your doctor, make sure that they're going to continue to participate in your plan going into next year and so forth. Make a list of your medications, and this is important both for Medicare Advantage plans as well as prescription drug plans. The prescription portions of either of those types of plans can change each year. The insurance companies can add or delete drugs from their formulary. They can move them up and down within the tiers of that formulary. So your copay amounts may change, that type of thing. So again, it's really important to take a look at the list of medications that you're on, especially if you've had prescription medications added during 2022. You want to make sure that those are going to be covered going into 2023. You should have gotten an annual notice of change in the mail. It's usually a pretty hefty little book, probably the size of a small town phone directory. It is good information from the standpoint of exactly what changes your plan may make next year. If you are on a Medicare Advantage plan, you will get an annual notice of change. If you are on a prescription drug plan and a supplement, you'll get a notice of change for your prescription drug plan. And it's really fairly easy to take a look to see what changes are coming up. Typically, they will be two columns. One side will say in 2022, it was this, and in 2023, it's going to be that. So you can go through there to see what changes might be coming up with your plan. And then we always recommend that you meet with an advisor around your Medicare Advantage plan or your prescription drug plan, just to make sure that nothing negative is going to happen going into next year. So we talked a little bit about prescription drugs. The Medicare Advantage plans should become very stable in terms of the networks that they have and so forth. But prescription drugs continue to be a concern for people because the formularies change and the costs go up. This is an example of a client of ours. He was on these 5 medications that I'm not even going to attempt to pronounce. But in 2021, we did a plan review for this gentleman. Excuse me, the plan that he was on, he was spending, excuse me, about $1,890 a year for his prescription medications. He had some tier 1 drugs, some tier 3 drugs, and a tier 4 drug. In 2022, that plan changed, and the Xarelto, which is one of these I can't pronounce, was dropped from his plan's formulary. And what happened as a result of that is that his prescription costs went from $1,890 to over $6,500. Not a good thing for him. So again, we were able to go out, take a look at other plans, and found him one that included all of his prescription drugs, actually ended up saving him money going into 2022. So this is a good example of why it's really important to review at least the prescription portions of either a Medicare Advantage plan or a standalone prescription drug plan. The other thing we like to point out is that, and this is kind of a difficult slide to read, these plans can put the medications that they cover in the tiers that they prefer to. So probably the most obvious example here is the Spiriva at the bottom. There are plans that will have this drug covered anywhere from about $50 a month all the way up to $500 a month. So again, it's important as you're looking at your drug plans to not only make sure that the plan is going to cover your medication, but it's also going to do it in the most cost-effective manner for you. So there might be some other reasons to change. There are some things coming up for Medicare this year. If your plan changes and you don't like what's changed, you can certainly change your Medicare Advantage plan. I always like to point out that Medicare Advantage plans are guaranteed issue from year to year and from company to company. So even if you have some pre-existing conditions, you can switch your Medicare Advantage plan with no questions asked. So don't worry about your health conditions and that type of thing. If you are on an Anthem plan this year, you can switch to a Humana plan for next year. That's not an issue. Plan premiums can change and go up. Medicare supplement plan premiums always go up every year, both due to your age and also due to just inflation. So again, if that plan premium is starting to get less and less affordable, or you're not using that Medicare supplement plan the way you thought you would, it may be worthwhile to consider switching plans and maybe looking at a Medicare Advantage plan. There are plan situations out there where one plan will have more benefits or lower costs than another. Again, that copay structure, the maximum out of pocket, the supplemental benefits are going to change from plan to plan to plan. So it's worth maybe just taking a look to see what else is out there. Again, your situation may have changed. There may be new doctors that you're seeing. They're not currently in your plan's network. Medications change and that type of thing. So again, that's a good reason to change plans each year. We talked before about medications being dropped from a plan's formulary. Certainly a good reason to change. Doctors can, leave networks. It happens all the time. People retire and networks change. Excuse me, I don't know why that is. Sorry about that. Let me get my mouse back where I thought I had it. There we go. So again, providers can change, networks can change around that. And then finally, you just might be in a situation where you need more agent support. A lot of people will enroll in a Medicare plan through an agent or a broker and then never hear from that person again. So again, if you need that additional agent support, might be a good reason to change. One of the big things that is coming to Ohio this year there are plans out there that are going to be advertising Part B premium givebacks. So currently, your Medicare Part B premium for most people is $170.10 a month. These plans are saying we are going to kind of rebate part of that Part B premium back to you. It's kind of an enticement for you to join their plan. Obviously, it can be a good financial thing for people. There are some situations, though, that you want to kind of keep an eye out for. It might be a good reason to switch plans if you can find a Part B premium give back plan that's a good fit for you, but it's not always going to be a good reason to switch. And we really encourage people to kind of get into the fine print and do the analysis on these plans because they may have limited provider networks. We have looked at these pretty thoroughly since the plans came out at the beginning of the month. And these plans, in some cases, will have very limited provider networks. Many of them have also increased their deductibles or copays or maximum out of pockets. So again, it's not always maybe what it appears at first when you kind of look at these Part B premium givebacks. I'm not saying they're a bad thing. I'm just saying that the devil can kind of be in the details. So we're happy to help you do the analysis to make sure that if you think you'd like to switch to one of these plans, that it's really going to do for you what you think it will. One size does not fit all with Medicare. We hear this all the time. There are 200 different Medicare plans available in the state of Ohio. So certainly, if it was a one size fits all type thing, there wouldn't be 200 options out there. We also hear from people that, well, my brother-in-law, my neighbor is on this Medicare plan. He thinks it's the greatest thing ever. That's the plan that I want. We really caution people against that because that plan may be a good fit for that person, but there's a good chance that he's seeing different doctors, taking different prescription medications, has different health issues than you do. So we really encourage people to be a little selfish when they're looking for their Medicare plans. Always like to address Medicare supplements and Medicare Advantage plans this time of year. This is the time of the year that if you are on a Medicare supplement and it makes sense to switch to a Medicare Advantage plan, you can certainly do that. Medicare supplements very much mirror the benefits that you get from Medicare Part A and Part B, and they're limited pretty much to that Part A and Part B coverage. Medicare Advantage plans will have expanded benefits, so things like dental and vision and hearing benefits that you don't see with a supplement plan and that you can get through Medicare Advantage plans. The other thing, as I mentioned before, supplement premiums go up every year. They go up every year as you age, and they go up every year just due to inflation and so forth. Medicare Advantage plans are typically $0 or very low monthly premiums, and then they just have copays to go with it. In terms of commitments, depending on kind of where you are in the journey, if you switch from that supplement plan to an advantage plan, you may have the opportunity to go back. So again, it's a situation where you want to make sure that your options are out there for you. Those guaranteed issue rules don't apply when you're switching from a supplement to an advantage plan. So again, if you have health issues and that type of thing, moving from a supplement plan to an advantage plan is absolutely no problem. You can make that switch from your supplement to that Medicare Advantage plan, but only during this annual enrollment period. There is one kind of exception to that if you do have a 5-star rated Advantage plan in your area, then you can switch at any time during the year. But for the most part, this is the time of year to kind of compare your cost and coverage and benefits from your supplement to what's available through Medicare Advantage plans. To get into a little bit more depth on Advantage plans, some of the things that these offer are an over-the-counter allowance. Most plans out there now provide X dollars per month or X dollars per quarter for those things that you stock up on all the time. So things like pain medications and allergy medications and vitamins and so forth. Those are the types of things that you'll be provided a certain amount of money each month or quarter for that stuff that you stock up on at CVS or Walmart or what have you. As I mentioned before, Medicare Advantage plans will typically include dental, vision, and hearing coverage. In some cases, they will have enhanced dental coverage over and above just kind of the routine cleanings and x-rays each year. There are plans out there that will provide several $1,000s towards the purchase of hearing aids. I know hearing aids are not inexpensive. In-home safety devices, so things like fall detection systems or grab bars can be part of Medicare Advantage plans. Transportation to doctor's visits. This is a big one as people get older and their driving skills tend to deteriorate, or in some cases they may have vision issues and that type of thing. Transportation to their doctor's appointments is a big deal. And if you can find a Medicare Advantage plan that's going to provide that for you, that can be a great thing. They will also provide meals after a hospital stay, fitness benefits through Silver Sneakers, and also some additional fitness benefits. There are plans out there that will get you a Fitbit so you can kind of track your activity on a day-to-day basis. With Medicare Advantage plans, their whole mission is to kind of keep you fit and well so that you're able to stay at home and stay out of the hospital and so forth. So that's kind of the overview for things to think about as you're looking at the annual enrollment period. As I mentioned at the outset, you're going to be seeing all kinds of ads on TV, and there's going to be all kinds of marketing materials coming your way and so forth. But we would encourage you to work with somebody that you trust to get good advice on your Medicare plans. So in terms of Retire Med, as I mentioned before, our service area is Ohio, Indiana, and Kentucky. So those are the 3 states we work in. If you happen to live out of that area, we can certainly refer you to somebody. But our advisors help simplify this process. We'll get to know you and exactly what your needs are. We have the ability to research your health plan options. We have an entire group here in our research area that will talk to you about the doctors that you see, the prescription medications that you take, and so on. And then they will go out, look at those 200 plan options, narrow that down to 1 or 2 options, and compare that to the plan that you're currently on. If the plan you're on is a good fit, we're not here to have you switch for the sake of switching. We'll tell you to stay right there if it's a good fit. We're not trying to rock anybody's boat from that standpoint. But if it makes sense to switch, we can help you enroll in that new plan. And then going forward, we provide lifelong support to all of our clients. And what that means is that anytime you ever have a question on your health insurance, rather than calling an insurance company somewhere and pressing 1 for this and 2 for that and spending your day on hold, you can call us and we will help run those bases for you. Whether it's something as simple as I lost my card and I need a replacement, or I need to see a specialist and I'm not sure if this person's in my network, I got a bill that I don't understand, any of that type of thing, we're here to help you from that standpoint. The good thing about this as well is that this is a no-cost service. There's absolutely no cost to work with Retire Med. People ask, well, how is that possible? That's too good to be true. The reason for that is that when we sign somebody up for a Medicare plan, we get compensated by the insurance company. People will then ask, well, does insurance company A pay you more than insurance company B? And the answer to that is also no. That whole compensation structure is very heavily regulated by the government. So from our perspective, we really don't have a dog in the fight in terms of the plan that you're on. We just want to make sure that you're in a good spot and that the plan you have is working well for you. So in order to get in touch with us, pretty easy. There's an 877 number here that you can call that will get you in touch with our program advisor group. They will kind of walk you through the process. They'll gather the information from you in terms of the providers that you see, the prescription medications that you take, and that type of thing. You'll then work with one of our benefit advisors who will explain your plan options, do that comparison to your existing plan, and if necessary, or if it makes sense, go ahead and get you enrolled in your new plan. There's also a website that you can visit to request a call or to start the process there as well. And with that, Marla, I'm kind of done. I'll be happy to answer questions.
Great. It looks like there are a couple in here already. Can you explain the difference between a supplement and a Medicare Advantage plan?
Yeah, just very briefly, Medicare supplement plans are medical insurance that mirror Medicare Part A and Part B. So a supplement is also known as a Medigap plan. And what these are designed to do is fill those gaps that Medicare doesn't cover. So for example, Medicare Part B has a $233 annual deductible. Once you meet that deductible, Medicare Part B picks up 80% of your costs. You're responsible for the other 20%. There are supplement plans out there that will pay either that full 20% or some portion of that. But again, it's going to be just the benefits that are available through Medicare Part A and Part B. Medicare supplement plan, or excuse me, Medicare Advantage plans, little different story. They will also cover those Part A and Part B benefits, but they also include prescription drug coverage. So if you have a supplement plan, you need a separate standalone drug plan for your prescription drugs. Advantage plans are kind of umbrella plans that include your Part A and Part B, as well as prescription drug coverage. And they have all of those additional supplemental benefits that we were talking about, the vision and dental and hearing and over the counter and what have you. The thing to keep in mind about Advantage plans is that they don't all offer every one of those various supplemental benefits. They kind of pick and choose and decide what they want to do. But you're going to get a lot more in terms of benefits from a Medicare Advantage plan. Medicare supplement plans have a monthly premium that you pay each year, or excuse me, each month. Medicare Advantage plans typically are $0 premiums, but they will have copays associated with services. So when you go to your primary care physician, for example, you might have a $5 copay. If you go in to have an MRI of your knee, there might be a $100 copay. So it just depends on what service you're having done, what that copay is. But those copays are maxed out at an annual out-of-pocket maximum. So it's not an unlimited type thing.
Thanks, Kevin. Kind of along those lines, this question says, on my supplemental, last year I was confronted by underwriting and denied by a less expensive company, even though my condition and treatment had not changed. Then premiums went up. Any way around this?
I'm not quite sure why that might have happened. I would need a little bit more detail on that, because typically once somebody is enrolled in a Medicare supplement plan, underwriting doesn't ever come into account after that. For people who are originally enrolling in Medicare supplements are guaranteed issue, so there's no underwriting at that point. And once you're on the plan, typically there's no underwriting down the pike. Now, if you were trying to change plans or change companies, that might be a different situation, because at that point you would be subject to underwriting.
Okay. And Part B is optional, correct? So some individuals feel that I have Part A and they assume they have Part B, but if they haven't opted into that and paying those premiums, it's not an automatic, correct?
That is correct. You have to kind of affirmatively enroll in Part A and Part B unless you're collecting Social Security. At that point, Social Security, once you're collecting Social Security, you'll be automatically enrolled in Medicare. However, if you are late to enroll in Part B, there could be penalties for that. There are a lot of people that work beyond age 65. If they're working past 65 and on their employer group insurance, you can delay Medicare. That's kind of a whole different webinar that we go through. So there are some conversations around working past 65 and Medicare. One of the big misperceptions out there is that you absolutely positively have to enroll at age 65. Not necessarily the case. There are a lot of people working past 65, stay on their group insurance, and then when they decide to retire at some point down the line, they have what's known as a special enrollment period, and they can enroll in Part A and Part B at that point with no penalties and no issues.
Especially this time of year, individuals over 65 are getting solicited by different companies that, claim to do the same types of things that Retire-Med does, and some of these agencies are charging for their services. Is there ever a time someone should be paying for these services to look into the comparison between plans?
I can't imagine that there would be. The information is available out there from the insurance carriers, from Medicare itself, and from other brokers. I hear that all the time, and I'm always surprised that people pay for this type of advice because it really is not necessary.
Great, thank you. Another thing we often hear as individuals are looking at becoming members of Kendal at Home is that, I really don't need long-term care insurance. I don't necessarily need Kendal at Home services because I have Medicare or this Advantage plan, and they'll pay for me to live in an assisted living or a long-term care facility down the road. And that's a non-truth, correct?
That is absolutely a non-truth. Medicare covers what Medicare covers, and long-term care, unfortunately, is not one of those things. It's going to cover, doctor's visits, hospitalizations, preventative services, all those types of things. But once you get to the point where you need assisted living, memory care, or any other sort of kind of long-term custodial care, Medicare does not cover that.
Someone is saying that using GoodRx is much less expensive than a supplemental drug plan. So does one need a supplement if you're utilizing?
I would recommend that anybody who has Medicare, just original Medicare or original Medicare with a prescription drug plan, or just original Medicare, also have a prescription drug plan. Unfortunately, we don't tend to get healthier as we get older in most cases. So at some point, and we deal with clients all the time that say, well, gee, I don't take any prescription medications. Why do I need a drug plan? And the answer is a pretty good chance that at some point down the road, you're going to need prescription medications. GoodRx is a great thing to use. And if you're going to save money with it, that's fine. But if you get to the point where that prescription drug plan is necessary, you don't want to be in a situation where you're paying those late enrollment penalties, because it's something that accumulates over time. The longer you wait to enroll in your drug plan, the higher those penalties get. And it's a monthly penalty that sticks with you for the rest of your life. So even if you're not taking prescription medications, get the least expensive drug plan out there, because it'll probably end up being worthwhile just by missing those late enrollment penalties.
I know you said this, but I just think it's important to reiterate that even if you're happy with your current plan, it is so important to go through the process and just see what changes have occurred to your plan, what new things are happening out there with other plans, just to make sure that it still truly meets your needs.
Absolutely. And again, especially with Medicare Advantage plans, the supplemental benefits have gotten so broad and so creative. It amazes me every year kind of what they come up with. We've seen plans with things like food for service animals. So, could come in handy for somebody. So it's worthwhile if you've got a special situation or a specific need. We're happy to kind of sit down and see, is there a plan out there that's going to be a good fit for you, that's also going to provide some coverage from that standpoint as well.
And a lot of times we have individuals that forget what those benefits even are. So 6 months, a year down the road or longer, they might be in the hospital and they didn't realize that their insurance plan actually provides some transportation or some meal coverage, or even some caregivers. We're seeing much more of the Medicare Advantage plans paying for some level of private duty care. So making sure you're making the most out of those benefits and having that information at your fingertips so that it can be referenced down the road is so important too.
Absolutely, no question about it.
Right. If you have a question for Kevin, and we've gotten a few, but you can click on Q&A or chat and we will try to answer them. And Kevin, I know you said you had a couple more open to the public presentations such as this coming up. Do you want to mention those?
Yeah, and Marla, I'll get you the links to those to register for them. We've got one on the 13th of October, and then there are two in November, and I don't have the dates right in front of me here. But all three of those are going to be at noon. The days are on, they're at noon, and I know that because I'm hosting them, but I just can't remember the November dates.
Great. I don't see any other questions coming through, but I appreciate all the information. It is so confusing, but taking the time, and I think you said number one, starting with making that list of medications is so important, and probably starting there. Is that what you suggest? Is
Yeah, I would start with the list of medications. Typically, we don't see, I mean, provider networks change, providers, may leave networks, but typically the networks with Medicare Advantage plans have continued to be pretty stable and very strong. In a lot of cases, they've gotten even broader. Our home office is in the Dayton area, for example, and in this area we have two really strong health systems, Kettering Network and Premier. But we have people all the time that say, if I see Kettering doctors or I see Premier doctors, but if I get sick, I want to be able to go to the Cleveland Clinic, or I want to be able to go to the James Cancer Research Center. And in those cases, there are actually Medicare Advantage plans that include those facilities in their network. So the networks are getting better and better by the day, or by the year, I guess I should say.
that's a huge point to point out, is that not everybody, and even needing referrals possibly for specialists and things like
Yep.
that, to know what your plan requires, so that you know how to handle those kinds of appointments that you need to set up too.
Exactly right. And again, that's what our client services group is there for, just to make sure that all that moves smoothly, that if you do need referrals, or if you have questions on those types of things, or questions on anything, we're here to support that as well.
Wonderful. Well, thanks again for being here today and all the great information. This has been recorded, so it will be available probably in the next week or so for individuals to reference down the road. If you haven't already, jot down the phone number and website, retiremed.com/Kendal at home, and they have representative specifically targeted to be able to answer our members' needs. So we appreciate that, Kevin.
Glad to do it. I appreciate the time, Marla.
All right, everybody have a great weekend.
Thanks,
Thank you.
everyone.